Good morning. Happy Tuesday and welcome back to JP, Kathy, and the crew here at 1160 AM, KBDT News Talk Sports. Discover America's news from a Christian perspective. Point of view today from noon until 2 only on 1160 AM, KBDT News Talk Sports. Hot today, high of 101, low tonight of 79. Currently in the Dallas area, we have 83 degrees. And if you've tuned in at 8:35 on a Tuesday, you are tuning in because of the so important, and JP and I are so proud of this segment. Every Tuesday from 8:30 until the end of the show, we bring you the mental health moment. We have got Steve Dunn and Patty Giolot from the Morgan Foundation and the Something for Kelly Foundation who brought this show to us, who produce this segment, who bring us excellent guests. And today's guest is a dear friend of all of ours who we just all think the world of. Anybody who's heard from this individual, met him, knows of him, knows what a great man he is and what a kind-hearted man he is. And he's got a story to tell, and this is so relevant. And please, after the show is done, we make our Facebook post, especially if you're driving right now, we make it live, and you can share it, and then Steve and Patty take it, and y'all put it on YouTube.
Yes, we do, right. And then we put it on LinkedIn and Facebook
and put it on all. And so there are going to be multiple ways to share this, and I am encouraging people ahead of time, share today's segment. It's extremely important. So, Patty, I'm going to turn it over to you to introduce our special guest today.
Great. Thank you, Kathy. Good morning, Phil.
Good morning.
Phil, every show we start with a professional talking about their area of expertise. This morning's a little bit different. You're not here to talk about your professional area of expertise. However, that said, give us a quick overview of that, and then we're going to get right into the subject at hand this morning.
I'm happy to do that. Thank you, and thanks for having me. So I currently consult for several treatment facilities, one for eating disorders, eating disorder solutions, the other the greenhouse for substance use, and I'm also a site director in the Denton County Medical Reserve Corps.
That's very important because we're going to talk about that Reserve Corps here shortly. The reason that we asked you to come on our show this morning is because you have personally experienced COVID, and before we get too far into it, you are in recovered state at this point. Is that not right?
That's correct. This is day 24. I've had a negative test 2 days ago, and I had another test yesterday, and I'm under contact tracing right now with Mass Gen and 3 other facilities, and I check in daily. But I am in the recovery side.
That's important, and we're very grateful for that, and we're very happy that you sound as strong and as good as what you do. And for anybody who would like a little bit of a historical perspective, Phil has posted on Facebook some videos that really, in the middle of this coronavirus, you can see how it can impact you emotionally, physically, and in many ways. So, Phil, just get started and tell us how you came about understanding that you have COVID, and talk from the beginning a little bit. Share your story.
Sure, thank you. So, everything seemed to be fine, and one day I had a headache, which is unusual for me. It didn't last long. It was just about a day, but my wife had pointed out that our youngest, our 21-year-old and our 22-year-old, had both been really ill, low-grade fevers and lethargic, and shortly thereafter I was tested positive for COVID. And about 4 days after I tested positive, I went into an abyss, 5 days, where my body determined it was going to fight the infection. During that period of time, my wife had worked with a physician to try to get me some medication, and finally she got me some steroids and antibiotics. But during that 5-day period, I was into a very black abyss where my body did everything it could to try to fight the infection. And that took me into a dark spot, very dark spot.
Now, Phil, when you were going out beforehand, you religiously wore a mask and washed your hands, were checked by nurses. Can you go into everything that you did, how you complied with the best advice out there, but this still impacted you?
Yes, I can, Steve. So the facilities I work at require constant temperature monitoring, mask, When we would check in the morning, we have 40 nurses at the greenhouse, and I would have a nurse every morning would check my temperature, would force me to use hand sanitizer, and then go wash my hands. If I left the facility to go outside to my car, I came back into the facility, I was once again checked. There's 130 patients, and so they constantly check. Anyone that enters for any reason or leaves for any reason, you're constantly checked. The same with eating disorder solutions. To walk into our facility, you have to be temperature checked, you have to have a mask on, you have to use hand sanitizer, and then you have to wash your hands. And we have signs up about what it means to wash your hands. Almost surgical wash.
That's a really interesting point that you're sharing there, in the extent to which they were asking you to have all of these precautions. So that window in time where it was allowed to develop should have been reasonably small and contained, and yet it was so severe for you as well. Do you want to talk any about the symptoms and what specifically was going on in those 5 dark days? Because I think that was a critical point for you.
Sure. So what happened was, I mentioned it in the video, but I was having violent body shaking and chills and body sweats, where my entire body was soaking wet, and I'd have to get out of bed. All the bedding would have to be changed and washed, and fresh bedding put down. During that 5 days, I dropped 26 pounds just through the body sweats. At one point, evidently I'd gone for a bio break, and I guess I passed out standing up, and my 21-year-old, who's 6'4", came in and grabbed me, took me put me in bed, covered me up with all the blankets, and then put his body on top of me to stop me from shaking, because I was violently shaking and hallucinating. At one point, there was 24 hours where I didn't sleep, but I was hallucinating. I remember visualizing. I thought my wife was sitting in a lawn chair, and I was upset because she was in a lawn chair, but she wouldn't speak to me. Another friend of mine and Ezekiel Elliott were talking about football plays, and they were in the corner, and they wouldn't speak to me. And there's a watch in an Edgar. There's a watch. I thought it was a person looking at me, and for hours I talked to this person looking at me, and I was disappointed that she wouldn't respond back. And this is, I guess, hallucinations, where I'm having a conversation with a watch.
Do you recall all of those hallucinations, or has somebody had to remind you, or did somebody record them? I think sometimes people don't even know they're hallucinating. Were you aware that you were hallucinating?
No, but my wife said I was having the conversation. She would observe me having these conversations.
Phil, now you're a military vet as well. Is that correct?
That's correct. That's correct.
And at one point, you actually got a combat wound.
Yes, that's correct.
How does that combat wound compare to what you went through during those 5 days?
Well, with any kind of a wound, there's a protocol. A doctor, someone says, "Oh, hey, we got this. We're going to give you some medication that's going to relieve the pain. You're going to be okay. Expect about 5 days. You'll be back on your feet. Whatever. We're going to get you up." I had no one to tell me what this looked like, and it just kept getting worse, and it just kept getting darker, and I couldn't believe the pain, and I couldn't believe it could get any worse. I couldn't see any way out. Can it really get worse, and how much longer will this go? And this is day 3. It's got to be over. It's day 4. It's. I don't know. I've never felt anything like it. It was just a dark. I can't even explain to you. Having never felt anything like this, it's not like the flu. You know what I mean? The flu, you're sick, you throw up, you don't feel good, you've got a headache, your stomach, but this isn't like that. This just is like each minute the pain increases.
So what was it that helped you to get through those 5 days? Was there a singular issue? Was it a collective event?
So a couple of things happened. My wife was talking to the doctor. She bought some watches that checked my oxygen, and so 7 by 24, it was checking my EEG, my heartbeat, my heart rate, and then my pulse oxygen levels. And she encouraged me to lay on my stomach. About the same time that happened, Jamie Schwartz, who's a friend, sent me a video from YouTube where someone gave an exercise to practice, and it's really a great exercise. I've sent it to a number of people since then, and it's 15 minutes 3 times a day where you do these practices and you lay on your stomach for 15 minutes and you prevent secondary infection or secondary potential for pneumonia, but you also raise your oxygen levels by doing the exercises. It's a physician that does it. It's on YouTube. It's remarkable, but those 3 times a day when I would do that, I would enhance my oxygen, and I could get my oxygen levels from 90 to 94, 96, 98. I could get my oxygen levels up high enough where I wasn't gasping for air.
Phil, for people out there who say that this is a political hoax, that one side of the government or the other is making this up and it's not real, what would you tell them?
Oh, please. Oh, it breaks my heart. I had thousands of people I don't even know that were praying for me, and I don't have enough gratitude. I wish I knew how to thank each person individually. But if you think it's a hoax, I look at that nurse in San Antonio that spoke 2 days ago that talked about how her patient thought it was a joke and said to the nurse just before she passed away, she wished she hadn't have thought it was a hoax. This isn't political. This is a tragedy, and it's getting worse every day. It's not getting better, it's getting worse, and I know it sounds like a beating because we're hearing it from everyone, but until you go through it, if you think there's something political or that this is some kind of that was created by the media, or you want to blame somebody, it doesn't matter what you think. When you get it, it's so painful.
You know,
Please,
COVID is a lot like another mental health issue. It doesn't respect color, socio-demographic, economic. Mental health and medical illnesses are not political. They are not hoaxes. They've got to be taken seriously.
And in this case, it's even worse if you're demographically, if you're from a minority community, the Black or the Hispanic community, where we're seeing the number of fatalities, the risk situation is so much greater. People are already at risk, but in the minority communities, the CDC, the CDC specifically has published the guidelines and has shown what has happened. And recently here, just in the Dallas area, one of the things that the county judge, Clay Jenkins, said, people that are South Dallas, they could have this disease for 8 to 10 days before they even realize or recognize that they have it, because it's taken that long for their tests to get back, whereas people on the north side will get there. I got a test the other day that returned in 15 minutes.
Well, and Philip, again, you know, your video was so compelling, and you were so gracious and so kind, which that's you anyways, with or without COVID. And you were just appealing to people to pray and to pray for people who are suffering with it. And you know, it's interesting. You talked about how your 6'4" son had to lay on top of your body so you wouldn't physically shake out of the bed. And it's interesting. The person who I was exposed to when I had to self-quarantine, you know, I was very blessed that I did not have it, and nobody else in my family ended up getting it. But the person who had it said that at one point his body shakes were so bad and so violent that he said he felt like he was having a seizure. So you know, here's the thing, you know, it depends on which reports you look at, and you know, unfortunately, politics is in everything, and people are skewing numbers for their scenario, but at the end of the day, you're just trying to appeal to people, and the reason you put those videos out there is from the human point of view. Like, just if you know somebody, pray for them. If you can deliver food, especially now you're fortunate, you had a family and friends that could help you. there are a lot of people who are suffering who don't have anybody who can help them. So I think this is where just being a decent human being comes into play. If you hear of somebody and they don't have somebody to help them, drop food off, drop medicine off, send them flowers, anything, pray for them. And we're going to be talking more with Philip about surviving COVID-19, and we're going to do that on JP, Kathy, and the Crew. All right, and thank you so much. This is so good, and we're still on Facebook Live right now. I was just, very proud to know you anyways, but I was just very proud, even more proud to know you when I saw those videos. Thank you, Kathy. And what I loved is that you posted one when you started feeling better, because I think people know if they're going through it, and different people have different reactions. I've also had some friends who have had it, and, it was, about what, the regular flu is, maybe not even that much. But especially for the people who are really suffering with the symptoms, I think your video talking about your recovery is even more important than the original video.
Thank you.
And
yes.
Phil, up to this point, we've really focused on the physical symptoms. Talk a little bit about the psychological aspect, how it affected you emotionally and mentally.
There's a point there where it's almost like, and I don't even know how to explain it to you, but you start to lose hope. Like, day 3, how much longer can this go on? And how bad you can't get any worse than this, but yet it's getting worse, and it continues to go. And I think Patty said it to me, we were chatting the other day. Patty said other people have a protocol, like, something happens and they say, oh yeah, for this you're going to do this, and in 3 days you'll start to feel better. Like when I had strep throat many years ago in the military, and they said, you're going to give you a shot, you're going to feel great. But there was no shot. I got a steroid and an antibiotic, but it didn't change anything. There was no difference. I took the steroids and the antibiotics every day. They weren't rescue drugs. It was almost like they were maintenance drugs, as well as there was just no one that could say, oh, you're going to feel good on the 4th day.
So, was there a point? Go ahead. I'm sorry.
No, it took me to a point of, I'm hopeless. I'm hopeless.
So, at what point do you really start questioning your own mortality and belief in a greater being, or are we just, is this it, and once we're gone, we're gone? What type of thoughts did you have along those lines?
I'm not sure how fatalistic I became. I'm not sure about that. But I know that Chrissy would say, somebody dropped a piece of paper off, let me read it to you. Somebody stuffed a note in the mailbox, let me read it to you. And she would read notes from people, or she would look at people were posting on Facebook, and the boys would say, Dad, 1,000 people have said they're praying for you. Those made a big difference. Those were really big.
The power of prayer, the power of prayer. We've got members of the crew asking, what was your specific treatment?
The oxygen exercises, the steroid, and the antibiotics. Christy signed me up for three different places for experimental technologies, but we were never contacted by anyone. And they offered to give me oxygen, but I had to go to the next town in order to get measured for it, and I didn't have the energy. I couldn't get out of the house, and I wasn't going to the hospital. And as long as my oxygen levels, my pulse ox were above 90.
Good morning and welcome back to JP, Kathy, and the crew here on 1160 AM, KBDT News Talk Sports. News, analysis, commentary, and debate. Don't miss the Wells Report with our own John David Wells. here on 1160 AM this afternoon from 2 to 5. Only on 1160 AM KBDT. Okay, it is hot today. It's very hot, so just take care of yourself, take care of your loved ones, take care of those fur babies. It's going to be 101 today, and then we've got a mild night tonight with a low of 79 degrees currently in the Dallas-Fort Worth area. We are at 83 degrees, and we're going to get right back into our guest here on the Mental Health Moment. And thank you so much, Phil, for being part of this. Thank you, Patty and Steve, for bringing Phil to us. This is a live account, and this is something you're going to want to share. This takes COVID-19, take the politics out of it, take the numbers out of it. This just puts a human face and a human aspect to this. And Steve, I think you asked something during the break about the mental, what this does to you mentally. I know the person who I was exposed to, they said at one point they thought the devil was literally knocking on their door, and they were so sick one night they felt that their spirit was trying to leave their body. So that mentally has to mess with you. So talk about that mental health component.
Phil?
Did we lose Phil?
When I got into, like I said, maybe the second, it could have been the third day, when you don't know when it's going to be over, there's a sense of hopelessness because you just can't believe it can get any worse, and it gets worse. And then not sleeping 24 hours, and I'm wide awake, or I believe I'm wide awake, although by that point I think I'm delirious, and it's not getting better. And I don't know, and there's no answer, and no one can tell me anything. It's like, how long can I survive? How long can this continue? And can it really get that much worse? Yeah, actually it can.
So, Phil, when we were on break, you talked about the treatment regiment you did. Can you go into that now that we're back on air, please? Yeah.
So I've got the exercises which I mentioned earlier about for oxygen to keep the oxygen levels good and to prevent the pneumonia. Which by this time it's like my attitude is almost like, what difference does it make whether I get pneumonia? The actual medications I got were, Christy had to talk to my doctor several times before she would administer them, and she gave us a steroid and an antibiotic, but they weren't rescue medications. It wasn't like, here, take these, and in 2 days you'll feel better. It was, here, take these, they may help.
Phil,
in other words, they can't hurt. Go ahead, Steve.
Right, okay. Phil, we have a question from the crew. This person asks, how much did the media propaganda impact your feelings that there was no way out?
I don't know that by the time I was in the depths of it, for that 5 days when my body was actually, I think, fighting the infection, I wasn't aware of any media. I wasn't aware of anything around me. I was barely conscious. And the only input I got was from Christy or the boy, Nikki or Mo. They were constantly checking on me, constantly. They would read notes to me from people that would drop notes off on the porch or text my phone. Christy was texting. My phone was on fire with people texting me, and Christy would respond. And then they would tell me what people were saying, and people were praying for me. And the boys said at one point there's like 28,000 people that are praying for me. I don't know 28,000 people. I'm just grateful that all these people. Thank you to every single one of them. If I could hug each one of you individually, I would. It made a big difference.
So Phil, what advice would you give to people out there today to minimize their risk of contracting this, and if they are afflicted, what can they do to help get through things?
Well, the exercise for the oxygen, that's so important. You've got to keep your pulse ox up. Christy had just gotten for her birthday some thermal health watches that monitor my pulse ox. So we had the pulse ox monitoring, and then also the exercises, the steroids, and the antibiotics.
Well, Phil, thank you so much for coming back on, especially while you're still in the recovery process. And we are so happy to hear that you're you are recovering and you're doing well and you're doing it quickly. The last time you were on the show, we were like, hey, come back. You didn't have to get COVID to come back. We would have invited you back anyways. You're a good guest.
Thank you, Kathy and JP and Steve and Patty. Thank you all.
Bet. Well, Steve and Patty, thank y'all so much. Phil, God bless you. We're JP, Kathy, and the crew. We come to you live every Monday through Friday, and every Tuesday, we are so proud of our mental health moment. Please tune in tomorrow, and we'll be talking more about the RPT convention, and have a blessed day. All right. Thank you, Phil.
Thank you, Kathy. Thank you, Patty. Thank you, Steve. Thanks to the whole crew. You guys are wonderful. Thank you.
Okay.
Wear a mask.
Okay, Phil. So we're still on Facebook Live right now. If there's anything else that we have not touched or that you want to talk about, now's the time.
Wear a mask. Hand sanitize. Carry hand sanitizers with you. Wash your hands. Every doorknob in your house has to be done over and over and over again. Every package you bring in your house, open it and wash your hands. There's nothing that can come into your house that's going to be beneficial if you don't wash your hands. Do not touch your face. This is not an airborne virus. This is something you're going to get by touching someone or being close to someone, or where you're going to get this by getting some infected something. It's infected. It's going to infect you. And the chances are, every day with these numbers escalating, if you don't wear a mask, if you don't social distance, if you don't continually wash your hands, you are going to contract this disease, and it's not going to be pretty.
Well, and here's the thing: you can do everything right, and you can still get it. So and that's why I think be prepared. Pray that you don't get it, but if you get it, just be prepared and I think if people can listen to like your two videos, the video when you were really sick, and then the video when you were recovering, then it gives people hope, and that's one of the things. And Patty and Steve, I'm preaching to the choir, but during our mental health moment, we always try to end with giving people hope that hey, it's going to be rough, but you can make it through to the other side.
And on one last note here, I have a very, very good friend. Our kids went to school together. He got COVID-19. This past week, he was asking me to contact his kids, saying he thought this was it for him. Fortunately, I heard from him last night, and he is recovering, but he is in the hospital. And David Allegro, my heart goes out to
pray,
you.
Yeah, the crew will pray for him then, and pray for anybody who's dealing with this in their family. And again, it's one thing if you've got loved ones around you supporting you and helping you. I think it's the people who are doing it alone that I feel, that's a
exactly.
toughest, so.
That message is
Phil,
important.
we love you. Thanks. Come back on again, not for COVID.
I love you guys.
Come back on for mental health.
Phil, thanks.
Doing your part for herd immunity.
Take care. Bye-bye.
Thank you.
Bye-bye.
All right, and love to the crew. Y'all want to say bye to the crew? Oh, who's on next week?
Oh, Steve, yeah.
It is Acadia Healthcare Week, and we're going to have a CEO from an addiction treatment center based out in California.
Oh, there we go. Excellent, excellent. So tune in next week, but tune in every day. All right, thanks. Bye, y'all.
Bye.
Love
Thank
to
you.
the crew. We'll see y'all tomorrow.
Be well.
Okay, let's see if I know how to end.